Hi, my name is Sean. This is my 3-4-2 video for a CVAD dressing change. I've identified that the patient needs a routine dressing change Q7 days, even though the dressing is dry and intact. I've checked the patient's chart for allergies. I've checked the CVAD policy guidelines and for a dressing change, and I've checked the CVAD care plan for the type of dressing, the location of the dressing, the initial measurement, the date of insertion, and the due date for the dressing change. The skill that I'm going to be performing today is the CVAD dressing change, the site assessment, and flushing the lines. I've gathered things that I'm going to look for at the bedside during my assessment that I won't say out loud are catheter damage, occlusion, infection, infiltration, migration, sepsis, skin erosion, extravasation, and emboli. I've gathered all my materials. I've wiped down the tray that I'll be using, the table that I'll be using, and I let it dry before I put everything on it. So I'm going to go to the bedside. I'm going to knock to ensure privacy. After I've conducted a PCRA, general survey, I'm going to come in. I'm going to close for privacy, wash my hands. Hi Pat, my name's Sean. I'm a third-year student. I'm going to be doing your dressing change for your CVAD today. Is that okay? Great. And this is closed behind me for privacy. Great, Pat, I'm just going to get set up. Pat, can you tell me your first and last name? I've got a sticker here with the name, and I compare that first and last name. Good. Pat Reese. Date of birth, Pat. And do you have any allergies? Good. Okay. And so all that matches to the chart that I've looked at. Pat, I've looked for safety equipment, oxygen and suction clamps, and Gelinette gauze, and petroleum impregnated dressing. So I'm just going to make sure the bed is at a comfortable height. Pat, can you tell me what you know about a CVAD dressing change? That's what we're going to be doing today. That's right. It's every 7 days unless it's soiled or loose or leaking. It's none of those things. It's nice and dry and intact, and it is 7 days. It does sit into the big vessel above your heart. You're right about that. And you can get blood products and different medications. It's good. It's also sutured into place, yeah, which yours is sutured into place, and it has these clamps on it, which it does on every lumen. Good. I'm just going to take this opportunity to make sure that these are secure. Okay. Pat, I'm going to put a mask on myself and a mask on you. You're able to tolerate that? Okay, so this takes about 15 minutes, 10-15 minutes. You have to lie on your back like this. Are you okay lying in this position flat for about 10-15 minutes? Yeah? Do you need to use the washroom? Are you in any pain? Good. And are you warm enough? Okay, so Pat, I'm going to start my assessment now just on your CVAD dressing there. I'm going to wash my hands one more time. I see that it is needing to be changed today. It's been 7 days. As I mentioned, there's a suture in place. The caps are secure. The clamps are in situ. The dressing's not leaking. It's not bleeding. There's no signs of swelling or infection. Pat, do you have any pain? And I palpate. No pain. Okay. So Pat, I'm just going to get my sterile kit set up. So wash my hands, wash this table and allow it to dry. This would be a good time to do vital signs before I get too far set up. Out of the package. Here. There.
Touch that, make sure to pull it back on. Now I also want to do hand hygiene before I put on my sterile gloves.
So. Good. And a garbage bag. I have a garbage down in the base there. I'm gonna
Make sure that my hands are not
open
trying to do this or
these up.
Alright, so
Place into the garbage. Put that down. Open this up. Okay, so just gonna move that away a little bit. So Pat, you're still doing okay? Okay, so I'm gonna start peeling away this dressing. Take that off. And we'll take this one off. Good, I'm gonna actually put this on my fingers here. And Pat, I'm just gonna start peeling away.
Now, this did not go as well as I wanted.
Good. Peeling away. I'm just gonna hold this secure on the hub here. You tell me if you need me to stop or you need a break. Okay. Good. Good. And I pull away to have it release. Okay. Good. Peeling away at the edges here. Pull this down enough, but not too much that I'm securing more or exposing more than the CVAD. Good. And I'm mindful that going towards the insertion site. Good. So. And now I should be able to use that to secure. Okay. This can go into the garbage. So that's okay. I did measure. If I didn't measure before, I would have measured before. I would go from the insertion to the end of the hub. This can go in the garbage. My hands. Yeah, I didn't measure before, so I have to measure. I'm just gonna come over in my sit right there. Open my
Okay, that should not take me so long. But here we go. I've got those on now. Perfect. So I can come back over here. Now that I've got sterile gloves, I am able to touch what's on the inside here. I'm going to start with a swab. That's worry. Be very careful not to touch anything else.
We have gloves. This goes into the garbage.
Do want to
My feet.
move away from sight.
Come in here. I'm gonna move away from sight, and I've got 15 seconds. So we're going that way. 15 seconds, and then we're gonna flip it and go 15 seconds away. Okay, I'm gonna try to get underneath best I can with this one.
Second one here. So I can
Okay.
continue.
And then I can let go. This hand is contaminated. We'll let that drop, so it's 15 seconds each side. Now we've got a second one. This one, I'm gonna do the other way. Hashtag 15 seconds. And do the top with this one. Okay. 15 seconds. And then flip it over and do this side 15 seconds. Okay, and the top side of the lines there. Okay, you can leave that there. This goes into the garbage. So we let that dry entirely. It's not going to dry on Pat. This time I can reach into my site. It's okay to break sterility. I reached in with my dirty hand there. That should be okay. This is totally dry, and I make placements so that the whole site is in place. Good. And lines are in sight and come from the inside out. You doing okay, Pat? We're almost there. The bed would be a little higher. Here we're just not taking the time for the exercise here. There we go.
Do you want to make sure that this is in here correctly? And we want to smooth this down, make sure it sticks really well.
There we go, Pat.
Because it's a little bit wet, it might not stick as well as it would on human skin that has been dry.
second one we can do.
There we are. Okay. So then we can take this off here. And we do want to keep these pieces.
Is
Perfect. Okay, that's on there. So then, the same thing.
there we go. What's up? Take these little wings off. Make sure the garbage is out of the bedside. Good. And then in the last little bit, I will write the time and the date today, as well as my initials for the dressing change. And I can use this last little piece to ensure that that is totally occlusive. Okay. The last little bits of garbage out of the bed. Okay. I'm going to measure. I'm going to measure. I take my measuring tape, which is right here. I take my measuring tape. I need measuring tape. I didn't have to leave the room, it was right here. I take my measuring tape and I go from the insertion site to the end of the hub. So that's just a touch over 4 centimeters. I take this measurement, I compare it to the measurement that I took at the beginning of the dressing change, as well as the initial measurement that's in the care plan. I then document in the power chart and in the care plan both my initials, the time and date of the dressing change as well. I can take my gloves off. This can go in the garbage. I'll wash my hands.
Okay. So now,
How are you doing? Okay?
very nice.
Okay, this looks
So I can go ahead.
like it's good. Are you comfortable? Clamps are in place, secure. This is when I would flush the lines and replace the caps. But we'll do this up. The call bill is here, right in reach here, if you need it. I'm just gonna do this up, and we'll lower the bed all the way to the ground. This is when I'll go and document to the care plan, power chart, all those such things, my daytime initials. Okay, this will be cleaned up. I'll throw all this in the garbage.
And I would make sure that that understands
This as well
any
in the garbage, and then I will wash my hands again.
And I believe that is everything.
Thanks for watching my video.